I think the rest is support evidence-based policing and resource allocation, improve information sharing and coordination among children protection stakeholders. Honorable Speaker, and this is signed by Honorable Kipchumba Murkomen, EGH, the Cabinet Secretary for Interior National Coordination. I submit, Honorable Speaker.
Donya. Honorable Donya.
Thank you, Mr. Speaker. I had raised a concern on the missing children in Kenya. What the chair has given, he has actually stated the organizations which are in charge of the works which go around at the Department of the Police. He has not elaborated on what the organizations are doing. He has just named like 100 organizations. In my statement, I didn't ask for the organizations or those who are in charge. So, Chair, I don't know what was wrong with you giving details on what the ministry is doing regarding the missing children. You have said then you will ask the Nyumba Kumi to do their work. We know the Nyumba Kumi are there. So you are just evading the responsibility as chair and the ministry in charge of this to take care of our children. Mr. Speaker, I didn't ask for the long list of the organizations. I just wanted to know the measures they are taking to ensure that our children have safety and their security is guaranteed. Thank you, Mr. Speaker.
Yes, Chairman.
Yeah, Honorable
Let's
Speaker.
take one more, Chairman.
Yeah.
Mama Zamzam.
Asante sana Mheshimiwa Spika, na mimi niweze kumuunga mkono dadangu Donya. Watoto wengi wanapotea Mheshimiwa Spika, na sio sawa wala si haki mwenyekiti kusema kuwa waweze kuwapatia wazee wa mitaa. Wazee wa mitaa hawawezi kuwa na ile machinery ambayo inafaa zaidi kujua watoto wanapotea namna gani, na hata wengi utapata wanavushwa boda Mheshimiwa Spika, wazee wa mitaa hawako kule. Kwa hiyo mimi ningeomba chair, haya masala ya usalama yamekuwa dondo sugu, na mimi ningeomba usukume sana, manake hata sisi Mombasa County pia nasukumwa sana kwa ukuta, na ndo hayo maswali ambayo tunauliza kila siku Mheshimiwa Spika. Kwa hiyo kama hana ufahamu zaidi, mimi ningeomba aende akatafute zaidi, ajulishwe ili atuletee jawabu mwafaka ndani ya bunge. Asante sana Mheshimiwa Spika.
Speaker, also allow me to weigh in on this matter. And I, coming from the border point, the issue of disappearance of children is becoming an alarming issue. While we have done a lot of work with the local administration and the schools and everybody else, we still believe the national government should do much, much more to protect an innocent child. Many of the cases, Honorable Speaker, the children are lured on their way from school in the mornings or in the evening, or just over the weekends or over school holidays. So we just want to urge the government to go out of its way to enhance public civic education and continuously remind parents it's their sole responsibility to take care of their children. Thank you, Honorable Speaker.
Yes, Tongoyo.
Thank you, Honorable Speaker. I respectfully also with the views of the members, but Honorable Speaker, referring to the statement, I think it was very clear. The first question is no dispute. It was enumerating the number of cases. I think that is, we have well done, and creatively they are quite alarming. On the second, Honorable Speaker, it was about the measures being taken to investigate, to curb the abductions. The other was in regards to confirmation of existence of effectiveness. Honorable Speaker, I think we tried to, the issue of protection of children involve both the government and non-government actors, to include the parents, NGOs, and even international actors. And that is, Honorable Speaker, the extent that the statement tried to go to explain the broader interventions to curb the vice. So, Honorable Speaker, I'm also really disturbed by the numbers, but the issue of enumerating the players is part of what the question sought to address.
Next is Honorable Mwango in the House. Yes, Chair Transport. Are you ready with the response?
Yes, I am.
Go ahead.
Thank you, Honorable Speaker. Honorable Speaker, on Thursday, 2nd July 2026, the member for Starehe constituency, the Honorable Amos Mwago, requested for a statement from the chairperson of the Departmental Committee on Transport and Infrastructure regarding the implementation of the instant fines system. The Honorable Mwago in the statement indicated concerns regarding the operationalization of the instant fine system, including the adequacy of road signage, public sensitization, system safeguards, and plans for nationwide coverage. Honorable Speaker, the Honorable Mwago therefore sought to, among other things, establish evidence that clear and visible speed limits and other traffic signages have been placed and motorists adequately sensitized on the operationalization of the system, and B, plans to ensure other road sections across the country are covered under the automated instant fine system, and C, system safeguards put in place to guarantee the accuracy and integrity of the instant fine system. Honorable Speaker, the committee received a written response from the Ministry of Roads and Transport, which I now wish to make. One, regarding evidence that clear and visible speed limits and other traffic signages have been placed and motorists adequately sensitized on the operationalization of the system, the ministry submitted that the road sections where speed cameras are currently being deployed are fitted with the requisite statutory speed limit signs. The ministry acknowledges that the availability and condition of traffic signs across parts of the national road network remain inadequate, and some signs have been vandalized, damaged, obscured, or removed over time. To address this, NTSA is engaging with Kenha, Kera, Kura, and other relevant road authorities to progressively install additional speed limit signs and advanced warning signage informing motorists that their speed is being monitored. Further, NTSA, through the Department of Road Safety Audit, is undertaking joint road safety audits and corridor assessments with the relevant road authorities to identify locations requiring additional or replacement traffic signs. Regarding plans to ensure other road sections across the country are covered under the automated instant fine systems, the ministry submitted that the National Road Safety Action Plan provides for a phased implementation strategy based on risk assessment rather than nationwide deployment at inception. The implementation program includes identification of high-risk corridors and urban areas using crash statistics and other safety data, progressive deployment of automatic speed enforcement demonstration projects or designated high-risk road sections, expansion of automated enforcement and compliance systems to additional road corridor based on operational experience and road safety priorities. Capacity building for enforcement and agencies to ensure standardized and technology-driven enforcement and continuous integration of enforcement systems with the road safety databases and monitoring systems to support evidence-based expansion of the program. And Honorable Speaker, regarding system safeguards put in place to guarantee the accuracy and integrity of instant fine systems, the ministry submitted that NTSA has established comprehensive legal, operational, and technological safeguards, including standardized operational procedures governing detection of offenses, verification of offender identity, issuance of notifications, electronic payments, handling of disputed offenses, data management, monitoring and reporting, technology-based evidence using certified speed detection devices, mobile surveillance systems, and approved digital enforcement platforms. Verification before notification to confirm driver or registered owner identity, right to fair administrative action, affording motorists an opportunity to admit liability and settle the prescribed administrative penalty, or dispute the notification through the legally established adjudication process, cashless payments processed electronically through designated government payment platforms, anti-corruption controls including prohibition of cash handling, digital recording of all enforcement actions, regular audits, monitoring of enforcement activities, established complaints mechanisms, and continuous system oversight, and continuous monitoring and performance evaluation through the governance framework established under the National Road Safety Action Plan, including quarterly performance reviews, annual reporting, key performance indicators, and continuous evaluation of enforcement. And lastly, Honorable Speaker, the ministry further submitted that the implementation of the instant fines system is contingent upon the decriminalization of minor traffic offenses currently provided for under Section 117 of the Traffic Act. And to facilitate this reform, the authority is developing a traffic amendment bill 2026 to establish an administrative enforcement framework for minor traffic infractions. The proposed amendments replace criminal prosecution with an administrative process under which traffic infraction notices may be issued electronically. Offenders may admit liability and pay the prescribed administrative penalty, or exercise their right to administrative review and appeal where the notice is disputed. I submit. Thank you, Honorable Speaker.
Thank you, Honorable Mango. Before you seek clarification, allow me to acknowledge in the Speaker's Gallery, Ronjena Secondary School from Narok West, Narok. Students, when you are mentioned, you stand up to be acknowledged. There is also Mary Mother Academy from Kieni, Nyeri. There is Ikawa School from Chuka, Igambangombe, Tharakanithi. And in this public gallery, we have Arena Comprehensive School from Kisumu, Central Kisumu, and Cheptikit Academy from Mount Elgon, Bungoma. On my behalf and on behalf of the House, we welcome the students, their teachers, and those accompanying them to the House of Parliament. Mwango.
Thank you, Mr. Speaker, sir. Even as I seek clarity, allow me to join fellow Kenyans of goodwill to welcome our latest Member of Parliament from Olkalau constituency, Sammy Douglas Kamau, who I campaigned vigorously for. He was called a Chokora, but is now in the presence of Parliament. Mr. Speaker, I wish to seek clarity from the Chairman Transport. I just ask a very basic question. Evidence that there are clear signages along the highways where they put the cameras, where they're enacting this automated fine system. It is clear that from his response, he's admitted that most of the signages have been vandalized, others are not clearly visible, others are not there. My question was very simple. How do you have cameras in a place where there are no signages? it is very unfair to find a person where there are no signages, but the cameras are operating. And the other question was, how are they sensitizing the people or motorists about this new system? I did not get an answer to that. I just had a very long story, a very ambiguous story around the whole thing, without coming out clearly. What are the measures put in place to sensitize many motorists? And what are they going to, how are they going to address the issue of the signages? Where there are no signages, how do you find a person where there are no signages? On the other issue of the integrity of the system, you can see there's a very big disparity in matters how these fines are, maybe these are applied. For example, you'll see a motorist fined 500, another one fined over 10,000, another 3,000. It is not standardized as he claims to, as he claims. So I'm not satisfied with this answer.
Thank you. Let's take one more. Kimani of Molo.
Thank you, Mr. Speaker. Mr. Speaker, I would like to remind you, Honorable Speaker, that you did guide that the Committee of Finance will be enjoined in this particular matter for this reason.
Yes.
That I raised the floor of this House. The punishment that should be done, the offense is not committed by the owner of the vehicle. It is committed by the driver. And I give a scenario. Take, for example, all the secured loans by banks, for example. So a bank, like Equity Bank, will have maybe 100,000 motor vehicles on the road that are registered in the name of Equity Bank. So therefore, if those fines are now levied on the logbook of those vehicles, then it's the Equity Bank that will pay those particular fines. Take, for example, someone who owns a fleet of Nissans or buses. I own 100 buses that commute between Rironi and Mount Summit. And every day there is probably a new driver. Then those fines will come to the logbook of those vehicles which I'm registered under. A more even practical example, think about our boda sector. 90% of the bodas that you find on the roads are not owned by the cyclists. They are owned by lending companies like Mogo, like Watu, like Mkopa. And therefore, when these fines then are levied on those lenders, because they're the ones who register those logbooks, then those businesses will certainly close down. I think it's very important, Honorable Speaker, that this matter be re-examined and to find a way of levying the fine on the person who commits the crime, who is the driver, and not the owner of the vehicle, Honorable Speaker. Otherwise, Honorable Speaker, the vehicle that you have, that you use in the village, that is someone who carries maybe your mother or your father from one place to the other, they keep committing fines and you keep seeing fines of 10,000 shillings every day on your phone. In a month, 300,000 shillings. It is not, it is not durable.
You made your point. Yes, Robert Bowie.
Yeah, thank you, Mr. Speaker. Mr. Speaker, you know, I'm a supporter of cameras on the roads because I think Kenya needs discipline on the roads. It's a very important thing because when you travel the world, you notice that, you know, people are very, very careful when they see the camera signs. And then you notice that accidents are much less than they are here. So it's a very good idea. But Mr. Speaker, even as we support it, it's, I can see the concerns many members have. And I have also another concern. On Langata Road, Mr. Speaker, there's a camera. I don't know where exactly. But I have been a victim, and I know a few people have been victims of the same. But sometimes you ask yourself, why would the camera be put in a place where there's no school next door, there's no place where people are walking on the road? It's basically a highway. Why would you put a camera there and put a speed limit in, Mr. Speaker, of 50 kilometers per hour? A place where if you move at 50 kilometers per hour, you're actually likely to cause an accident. So, Mr. Speaker, I think there is need for this to be sorted out and thought through before we actually implement it fully.
Mr. Speaker, I thank you, and I also must thank my neighbor, the Honorable Amos Mwago, for bringing this to Parliament. And maybe it would be informative for the chairperson of the Transport Committee to also do a search and spin and see the need is appreciated, the need for cameras
and surveillance on our roads is more than appreciated. However, Mr. Speaker, if you travel on the roads in Kenya today, you are never able to tell where the speed limit zones are. There is never a sign that shows you that the 110 speed limit starts here and this is where it ends. Secondly, Mr. Speaker, there is technology available that can be utilized by NTSA to ensure that when a charge is made, it is not occasioned on the owner of the vehicle, it is actually a charge that is put on the driver who was driving at the moment when the offense was done. So, Mr. Speaker, I do believe there is space for the Transport Committee to go back and examine the matter that Honorable Mwago brought to us and find how the technology will also work with the real life situation on the roads, and especially if they're digitizing the penalty system, that must also have real what you would call highway furniture, real road furniture, up to and including the traffic signs, Mr. Speaker. I do thank you.
Carola Mondi.
Thank you very much, Right Honorable Speaker. I think on the issue raised by the Chair of Finance Committee that liability should just be limited to the driver, legally may not be sound. I think we are familiar with the concept of vicarious or imputed liability, where the person held liable is a person who has what we call in law respondeat superior legal control of whatever has caused the accident, like motor vehicles or employees, employers. So it may not be very practical, and risks are normally allocated to those who can handle them best. So the reason why it will be the financier or whoever is registered.
Carola Monde, I thought there are graduated levels of responsibility. Speeding is personal responsibility to the driver. Allowing a defective motor vehicle to be driven by your driver, then you take vicarious responsibility. I thought that is, those are the graduated situations in the law.
Correct.
Isn't that so?
Correct.
So Kimani is half right, you are half right. So you can...
No, I don't. I just wanted to raise it so that we don't mislead the nation that there's no, that there's liability.
There is vicarious responsibility.
Yeah, vicarious liability or imputed liability, as it is called. Thank you.
Yes, Mkunji.
Thank you. Thank you, Honourable Speaker. I also rise to agree with the sentiment shared by my colleagues. Honourable Speaker, I'm an often user of Thika Road, and that is where these cameras have been concentrated. And Honourable Speaker, I believe the whole process of establishing these cameras must be a process that involves this House and involves the public keenly. Because, Honourable Speaker, one day while I was coming from up country, around 8 p.m., I found cars slowing down seriously, below 50 kilometers per hour, Honourable Speaker. And I was actually wondering what is going on. Only for my driver to receive a message the next day to pay 10,000 Kenya shillings, Honourable Speaker. And I would say that we need to agree that technology is the way to go when it comes to enforcement of our laws. But, Honourable Speaker, this is a process that must be keenly implemented and its procurement and establishment highly publicized, so that, Honourable Speaker, we don't have tribes of the public getting into even accident just because, Honourable Speaker, there is establishment of technology. Thank you, Honourable Speaker.
Oundo.
Speaker, I didn't go to the law school, but I know there's a principle that, honestly speaking, will end up this arrangement punishing motor vehicle owners more than punishing those who commit the offense. As you clearly say, speeding is a human endeavor. might not necessarily be a mechanical problem, but it's a human endeavor. And I want to give a very interesting case. Some years back, I was charged in Nakuru court for speeding. So when I went to the magistrate, being what I could do, I asked the prosecutor that who was driving the vehicle at the time you caught on the camera speeding. They said they did not know because the camera was unable to pick out the driver. And the magistrate agreed with me that the prosecutor was on a fishing expedition, so I was left scot-free. I fear that this is going to happen. And then, Honorable Speaker, a fine is a penalty for breaking the law. If you are purported to have broken the law, if you are not given a chance to mitigate so that appropriate punishment is meted out, would it not be unconstitutional to punish me unheard?
It is not. Read the law. There are what we call instant fines in petty offenses that the offender need not go to court. Those are called misdemeanors in law.
Honorable Speaker, for example...
You are the lawmaker.
Yeah. For example, Honorable Speaker, let's just look at a practical case. An ambulance speeding to take somebody to hospital. How would you treat the matter? On the other hand, I'm carrying an expectant lady who is just about to do it. I don't know what is to do it. I have to speed. So I need a chance to mitigate before I'm punished.
All those exceptions are there in law.
Yeah. So that's why we are saying
this
process, the way it is designed, is going to be extremely punitive and unfair to the people of Kenya, notwithstanding the fact that we need to enforce discipline on our roads. The amount of accidents we are having, the injuries that we are having can be avoided. But we need to find a more friendly and more people-focused approach to ensure that we deal with this malice once and for all. Thank you, Honorable Speaker.
Yes, GK, can you, sorry, Mama Zamzam? Hold on, GK.
Asante Mheshimiwa Spika. Mimi nashangaa nikiona viongozi wanatetea ile fine ya instant ambayo madereba ambao hawana uangalifu ndani ya barabara wanapewa. Mheshimiwa Spika, tumepoteza maisha mengi sana. Juzi na jana tumekuwa kwenye michezo kule Rwanda. Dereva hata ukimwambia nimechelewa mpira na kuambia hapana, kuna cameras, nikienda vibaya mimi ndio nitapigwa fine, watoto wangu watakosa chakula. Kwa hiyo Mheshimiwa Spika, sheria ni sheria, ukata mbele na nyuma, hamna cha hii wala hii. Na kisha nimesikia ndugu yangu mmoja akisema amempongeza mwenzake na akasema aliitwa chokora. Mheshimiwa Spika, wengine huwa na ile feeling, lakini mimi nataka kuambia hata Kasongo ambao wanamuita rais wetu wa ni Wathog. Kwa hiyo wao wakianza kuita watu majina, wewe tayari na wao pia kuitwa majina, wakae watulie. Lakini nikirudi kwa barabara lazima tuwe waangalifu, na hili ni jumba la kutunga sheria, lazima tuangalie sheria ambayo inaweza ikamkinga Mkenya kutokana na ajali za barabara. Asante sana Mheshimiwa Spika.
Yes, GK.
Thank you, Honorable Speaker. Honorable Speaker, the matter raised by members needs a bit of engagement with the ministry, but we need to ask ourselves what has occasioned this kind of intervention. Honorable Speaker, we are losing on average 5,000 lives every year. And this is not something that we can take lightly. We are here expressing anger over the use of technology, knowing very well, honorable members, that the use of technology is the best international practice all over the world. The use of technology replaces the roadblocks and the use of police officers on our road. Honorable Speaker,
yes, what's the point of order? Is it point of order or point of information? What is out of order?
It's a point of information.
Does he want information?
That's okay, Honorable Speaker.
Mr. Speaker, I must inform the Honorable Chair for Transport that members are not against any enforcement of any traffic rules. And in fact, we as members are part of forming the laws that govern traffic in this country. However, Mr. Speaker, the chairperson is not in order to refer to international practice, because what is occasioning traffic zones in Kenya is places where government has not been able to put infrastructure up to and including overhead crossing bridges. So we find ourselves in situation where an international highway, where standard speed would be around 110 kilometers, is reduced to 50 kilometers per hour, giving a perfect example of Mackenzie, near Thika, just past Thika at Del Monte, on an international highway, the Great North Road, limited to 50 kilometers per hour, Mr. Speaker, without any road sign showing where the speed limit zone starts and where it ends. So, Mr. Speaker, this parliament is not against international standards and international practice in traffic. It is to tidy up that the laws that leave parliament are implemented in a way that is not offensive to the users of these roads, Mr. Speaker. I thank you.
Do you want to be informed again by Member for Molo?
That's okay, Honorable Speaker. It's okay. But Honorable KJ was not informing. I think he did something different.
He was debating.
He was debating. I hope.
Thank you, Honorable Speaker. Honorable Speaker, the chair did say that we are angered by use of technology. And I find offense in those words. What we are saying, Honorable Speaker, and you rightly put, where the mistake has been committed by the owner of the vehicle, let the fine be on the owner of the vehicle. Where the offense has been committed by the driver, let the fine be on the driver. And I think the chair should take that very, very seriously, because that is going to be a very big decision to make, and especially as I outlined the businesses that will affect, especially the banking and all those financial sector institutions, Honorable Speaker.
Go on, GK. You've now been informed.
Honorable Speaker, before I get to, I respond to Honorable Member for Moro, let me address the issue raised by Honorable Mokonji about this matter having been debated in this House. Honorable Speaker, this law permitting the ministry to use technology was passed here in Parliament. And we all debated and agreed that the use of technology is the best way forward to address the many deaths that we are experiencing on our roads. We have had many special motions in this House.
Chairman, if you listen carefully, there are just about 2-3 categories of concerns. Number one is that the speed cameras you put on the highways must be visible and must be relevant to the situation. So there is not a continuous speed limit on the highway. There are speed limits where there is need for extra caution and care. That's what I've picked from your colleagues. Number two is the point raised by Kimana and Karoli Omondi. When do you apportion personal responsibility to a driver and vicarious responsibility to the owner of the vehicle? That is the second point. The third point raised by several members is that having passed the law is not enough. You must continue with public awareness and public education, given what you are saying, the unacceptable number of people who are losing on the roads. So if I was in your place, which I'm not, you should be addressing those 3 points.
Well guided, Honorable Speaker.
Yes, Mukunji, what is it?
For this law to work for the people of Kenya, Honorable Speaker, we should have at least 3 months of continuous information on phones so that people can know.
That is methodology. Let
Yes.
him answer. That's methodology. The principle is the same.
Honorable Speaker, I don't want to overdwell on Honorable Mukunji's point, but the ministry indeed engaged in that exercise, and it was actually more than 3 months. I remember they started sending messages to us to alert us that the use of instant fines through technology would be employed, which is what is happening. Honorable Speaker, when you think of a road, a busy road like Thika Highway, where at some point where KJ has mentioned Mackenzie, 50 kilometers per hour is very punitive. It is not even possible to drive at that speed. It causes a traffic snarl-up, which is inconveniencing motorists. And that is something I have personally raised with the ministry and NTSA agency. Honorable Speaker, the gaps that are that have been identified by members are being addressed by the ministry, and I will follow up, Honorable Speaker, together with my committee to ensure that these concerns are well addressed. Honorable Member for Molo, I am sure the issue that you have raised needs to be interrogated, needs to be checked so that we see who is supposed to carry the blame. Is it the owner or is it the lender, or is it the borrower? Is it the driver or is it the owner? I personally have had issues with my drivers when they engage in, when they are fined, when I'm fined on offenses that are caused not by myself. And it's something that needs to be checked. Honorable Speaker, if you allow me, I will again go back to the ministry and ask them to address these very important concerns. Thank you, Honorable Speaker.
Thank you, honorable members. In the Speaker's Gallery, I acknowledge Starehe Boys Center from Starehe constituency, Nairobi. Chemase School from Tinderet, Nandi. In the public gallery, we have Kariobangi North Primary School from Embakasi North, Nairobi. Kiriko Junior from Kinangop, Nyandarua. Kiplongon Primary School from Eldama Ravine, Baringo. And Pine View Academy from Eldama Ravine, Baringo. Honorable members, on my behalf and on behalf of the House, we welcome the students, their teachers, and those accompanying them to the House of Parliament. That ends statement hour. We now call the next order. Clerk.
Order number 8, the Trade Description Amendment Bill, National Assembly Bill number 42 of 2026, first reading. A bill for an act of parliament to amend the Trade Description Act and for connected purposes.
Next.
Order number 9, the Legal Metrology Bill, National Assembly Bill number 43 of 2026, first reading. A bill for an act of parliament to make provisions for the manufacture, sale, and use of weighing or measuring equipment in trade, health, safety, law enforcement, environmental protection, and sale of goods, and for connected purposes. Order number 10, the Kenya Economic Zones Bill, National Assembly Bill number 46 of 2026, first reading. A bill for an act of parliament to provide for the establishment and declaration of special economic zones and export processing zones, to establish the Kenya Economic Zones Authority, to provide for the promotion and facilitation of global and local investors, the development and management of enabling environment for such investments, and for connected purposes.
Now go to order number 14.
Order number 14, motion, consideration of a petition on the management of hemophilia and other bleeding disorders.
Dr. Nyikal.
Thank you, Mr. Speaker, for this opportunity to report on this petition. Honorable Speaker, I beg to move that this House adopts the report of the Departmental Committee on Health, a report on public petition number 001 of 2026 on the management of hemophilia and other bleeding disorders in Kenya, laid on the table of the House on Tuesday, 23rd of June, 2026. Honorable Speaker, public petition number 021 of 2025 was submitted by Mr. James Cargo, Treasurer of Hemophilia Association of Kenya, on behalf of hemophilia patients across the country, and was tabled in the National Assembly on the 8th of March 2026. The petition was referred to the Departmental Committee on Health for consideration. Mr. Speaker, the petition highlights the significant burden of hemophilia in Kenya. Mr. Speaker, Madam Speaker, hemophilia is a bleeding disorder that affects the clotting ability of blood in the body, such that patients who are affected bleed excessively, are unable, their blood is unable to clot, and they bleed in organs, often the knees, sometimes in the brain and internal organs, causing severe damage to joints and many times causing death. It often affects male children, male persons, because it is sex-linked. Madam Speaker, it affects an estimated 4,000 to 4,500 to 5,500 Kenyans, yet only about 1,300, about 23% have been formally diagnosed, meaning, Madam Speaker, that a lot of people suffer, and some even die. Madam Speaker, this is a disease that is challenging in treatment because I've said many are not diagnosed. It is expensive to treat, and the treatment centers are few in the country. And it's also extremely expensive to manage. Currently, it is through donor support that most people get management and care through the World Federation of Hemophilia. And the support they give is valued at about US dollars 20 million. That is almost 2.6 billion annually. Even this contribution still covers only about 30% of what is required to buy just the clotting factors, leave alone the other support that is needed. And worse still, Madam Speaker, the memorandum of understanding governing this support is actually expiring early next year. So without urgent domestic financing and sustainable supply, Kenya faces a preventable human crisis that will leave thousands of patients without this life-sustaining treatment. Madam Speaker, hemophilia treatment, expensive as it is not covered in our current Social Health Authority benefit packages. And Madam Speaker, this is a very expensive treatment. One dose of the drug that is used, which is a factor concentrate, actually costs 50,000 shillings. And in most patients in a year, about 1 million shillings. Not many Kenyans can afford this. And yet it's not covered as I've indicated. This level of expenditure is burdensome and catastrophic for most families with hemophilia patients. The National Health Insurer needs to make provision for hemophilia treatment so as to ease the burden of families of persons living with hemophilia. The petitioners therefore prayed, Madam Speaker, for the committee to effect the following. 1, recognition of clotting factor concentrates as essential medicine for both adult and pediatric hemophilia patients' treatment to ensure their consistent and sustainable availability in Kenya. 2, that the government strengthen infrastructure and capacity by establishing additional hemophilia treatment centers across the country to enhance diagnostic capacity, improve healthcare worker training, including specialized pediatric care, reviewing medical curricula in school to incorporate management of hemophilia and other bleeding disorders, and increasing funding for public awareness, particularly in relation to early childhood screening. Madam Speaker, as it is now, we have just about 15 centers in the country that can look after these patients, and some just give supportive treatment. Effective treatment is only in Kenyatta National Hospital and Moi Referral. So you can see how many people are suffering to get services when they have this problem. Two, the petitioners are also asking us that there's need for formal recognition of hemophilia as a disabling condition to enable registration with the National Council of Persons with Disabilities, as well as inclusion of hemophilia treatment under the Social Health Insurance Fund. 4, any other measures that the National Assembly deems appropriate to address the plight of persons living with hemophilia. Madam Speaker, the committee considered this petition and met with the petitioners, the cabinet secretary, and 3 patients that are affected and other stakeholders. And after several very serious considerations, Madam Speaker, the committee made the following recommendations, and these are really the most important. That the Cabinet Secretary, Minister of Health, includes clotting factor concentrates, that is what we use for treating them, covering both adult and pediatric formulations as essential medicines in the Kenya Essential Medicines list, which will then make it part of our regular treatment armamentarium. That the Minister of Health, the Kenya Medical Supplies Authority, and county governments ensures sustainable procurement and consistent distribution and availability of the factors within the national supply chain, including through pooled procurement arrangements with local and regional and international agencies, because often these are not available locally. So working with international agencies is important. That the Cabinet Secretary, Minister of Health, and the Social Health Authority, and the Benefits Package and Tariff Advisory Panel to develop comprehensive hemophilia benefits package under the Primary Health Care Fund, the Social Health Insurance Fund, and the Emergency Chronic and Critical Illness Fund that will make provision for clotting factor infusions, specialist consultations, hospital admissions, physiotherapy, diagnosis, and screening, as well as psychological support. Screening is particularly important because diagnosed early, these patients can actually be supported and avoid disabilities and even death. That the Minister of Health and the National Board for Social Protection recognizes hemophilia patients and their caregivers as vulnerable persons and affords them the necessary social assistance and social care pursuant to the Social Protection Act number 12 of 2025. Madam Speaker, it is important that these patients with this chronic illness, often debilitating, benefit from social protection just like other people. That the Minister of Health, in collaboration with the National Council for Persons with Disabilities, classifies hemophilia as a disabling condition to afford hemophilia patients access to benefits and protection available to all persons living with disabilities, including tax waivers for adults, even support with assistive devices. That the Minister of Health, in collaboration with the county government, established additional fully fledged hemophilia treatment centers with trained clinical staff, diagnosis capacity, and reliable access to clotting factor concentrates, which is key in their management. That the Minister of Health, Minister of Education, Healthcare Professional Statutory Bodies, and Kenya Medical College incorporates hemophilia management in the clinical training and education curriculum. Madam, we actually noted that many health professionals come out and actually are not clear and cannot make early diagnosis, endangering the lives of people, particularly at first contact, when it is most useful to make a diagnosis. And also continued care in this specialized area. That the Minister of Health and county governments regularly train community health promoters and community health officers and assistants on early identification and referral of bleeding disorders. Community health officers and community health promoters is a new cadre, and most of them actually do not have adequate training in this area. So this is important. That the Digital Health Agency introduces a national hemophilia registry under the Comprehensive Integrated Health Information System established and maintained under Section 15 of the Digital Health Act. It is important, Madam Speaker, that we have a proper registry, that we have proper records, because this is a chronic illness, expensive to manage, so we must have adequate data for even budget provisions. That the Ministry of Health undertakes national awareness on bleeding disorders, including hemophilia. It is important, Madam Speaker, that people know about this, and so the ministry needs to actually roll out training so that people are aware of what happens. Very, very few people know about this, and sometimes people even go into minor surgeries and actually suffer severely. That if they were aware, they would know that they cannot undertake such minor surgeries. Honorable Speaker, in the light of the recommendations by the Departmental Committee on Health on its report on public petitions number 001 of 2026 on the management of hemophilia and other bleeding disorders in Kenya, I beg to move and urge this House to adopt this report. And I really ask members to support this. As a committee ourselves, Madam Speaker, we noted that the National Transfusion Center that deals with blood is not properly financed. And we were a little bit surprised at the low level of financing of 300 million shillings per year. We decided in this budget to double it, but even that is far from adequate. And the committee is committed that will actually lobby for more financing for this disease condition. Therefore, Honorable Speaker, I beg to move and ask Honorable Lenguris to second.
Yes, proceed. Thank you, Madam Speaker, for this chance to support this report on management of hemophilia and other bleeding disease disorders in Kenya. Madam Speaker, from the report from the Committee of Health, we can hear that this is a very fatal disease, Madam Speaker, that is a life-threatening. Madam Speaker, this is a disease that's characterized by severe bleeding that comes at any time. We have also heard from the report, Madam Speaker, that we have a big challenge in the country in the management of this disease. This is a disease that needs very urgent treatment when it comes. And from the report, Madam Speaker, we can identify that there are also challenges in the treatment centers in the country. So, Madam Speaker, I want to support this report and request the ministry to put strategies in place to ensure that patients with this kind of disease also get treatment like any other patient in the country. Also to ensure that access of treatment and also improving or increasing the treatment sites in the country is one of the most urgent things that the ministry will need to do. I want to appreciate the work that has been done by the committee because, Madam Speaker, we have identified that there is a big gap on access of treatment by these patients who are suffering from hemophilia. And this is a fatal disease which is also characterized by a lot of high mortality rate. Because if these patients are not managed well, it is a condition that can kill very fast or very easily. So I will urge the Ministry of Health to follow the recommendations, the outlined recommendations by the committee, this committee, to be able to establish centers that can take care of these patients. We have also gone into ensuring that recommending to the SHA
to ensure that this is one of the conditions that we support under the share coverage, so that they also benefit, because it is a very expensive disease, and if you don't support them, Madam Speaker, our patients will be suffering. So I want to support this report and urge the ministry to give a lot of attention to the recommendations that have been set aside by the committee to ensure that we serve these patients with a lot of care, with a lot of urgency, and ensure that even the centers are increased in the country so that patients can access, because at the current, there are only 2 treatment centers in the country. So patients, you can imagine all over the country, patients clocking up or crowding in the 2 facilities. So this is one of the things that we need to give attention and also support with the budgetary so that they can, our patients can get support and also get any other support that they can get from other relevant government ministries. Thank you, Madam Speaker, and I support the report. Thank you.
I second.
I said already, I second.
Honorable members, I now propose the question that this House adopts the report of the Departmental Committee on Health on its consideration of the public petition number 01 of 2026 and regarding the management of hemophilia and other bleeding disorders among the patients and children in the country, laid on the table of this House on Tuesday, 23rd June 2026. Honorable members, before I open it for debate, allow me to recognize the presence of Eldoret Achiever School from Kapseret constituency, Uasin Gishu County, who are seated in the public gallery. On my own behalf and that of the substantive speaker and the rest of the National Assembly, we wish to welcome Eldoret Achiever School to the proceedings of Parliament. Karibuni sana. Honorable Pukose.
Thank you, Honorable Speaker. And I know that the Eldoret Achievers are now seeing their women rep as the deputy speaker in the House. I hope that they are very proud of you. Honorable Speaker, I stand to second this important report by the Committee on Health, which I'm a member. Honorable Speaker, hemophilia, for those who don't understand, is a genetic inherited disease that affects mainly male, and women are the carriers. So you find that this is a bleeding disorder. There is failure of the clotting factors to, once somebody is injured or gets a cut, those clotting factors, there are 2 types. You are talking of type A and type B. And you have clotting factor 8 and clotting factor 9, which makes when you are cut, you find that your blood can now be able to clot. So that factor is missing in the inheritance. And once it misses, then when you get cut, you will find that these people bleed. They bleed seriously. And at times, Honorable Speaker, you will find that maybe a boy is taken for circumcision without people knowing. And once he's circumcised, you will find that this child will bleed to death or even gets injured. You will find that the hemophilias are exposed. They might even just be traumatized. Through trauma, they get injured, maybe any part of the body, and the bleeding is that serious. So, Honorable Speaker, normally in the hospital, we have trained hematologists who handle them. And you'll find that these trained hematologists give them the factor concentrates. This is what is missing in their blood so that their blood can be able to clot. And these factor concentrates, they are not available locally. They are imported. Kenya does not manufacture factor concentrates. They are imported from outside. And this is a very expensive venture because apparently since the Ministry of Health does not provide for them, you have an NGO that has been supporting through donor funding. And this donor funding has been supporting by purchasing these factor concentrates. And therefore, Once the donor funding is now going to stop, then you have these Kenyans exposed. You have these Kenyans not having factor concentrates. You have these Kenyans not able to, Honorable Speaker, they are not able to import that factor concentrate. You'll find that it's the donors the donors who are importing them and supplying to various facilities. Kenyatta National Hospital, Department of Hematology under Professor Mwanda is the one which has been supporting them, and other hematologists throughout the country. So you'll find that, Honorable Speaker, once the factor concentrates are not imported, then these Kenyans are exposed. It means once they get a cut, there is nobody who will be able to assist them. You will find that these factor concentrates are given on regular basis, maybe twice or even 3 times in a week. And as Honorable Nyikal put it, one bottle of the factor concentrate is costing 50,000. So you can imagine 50,000 times 2 times 3, that is around 150,000 per week. Times 4, you'll find that you are talking of an enormous figure which they cannot be able to afford. So what we are asking the ministry is, as per the recommendations which we made, can we have it under SHA? Can we have it also being part and parcel of our medical system so that when you go to KEMSA, it's available and it's be able to be supplied to those centers where we are able to treat cases of hemophilia. With those few remarks, Honorable Speaker, I want to support the recommendations of the committees and hope that the Ministry of Health will be able to act on them. Thank you, Honorable Speaker.
The Honorable Martin Owino, member for Ndiwa.
Thank you, Madam Speaker. As a member of the Health Committee, I also stand to support this report. And thank also James Cargo and the hemophilia team for petitioning the Parliament to take consideration of this life-reducing disease. Madam Speaker, it's not a matter of cost. Anything that hurts Kenya should be addressed. And it's no good also to say that only donors can address. If donors can come and address issues of our own people, how about ourselves? When one bleeds, family bleeds, and all of us bleeds. So as the chair said, we need first of all to recognize these clotting factors concentrate into our medicine essential kits so that they can be brought together with primary health care medicine. Madam Speaker, access is the issue here for those who are suffering from this ailment. Access in time of facility operations and also access in terms of distance and access to the medicine themselves. As it was said, only 15 facilities are available. I think, Chair, we need to increase this to at least 47 facilities so that we have at least one facility in a county providing this treatment to the people. As far as inclusion in SHA benefit, I think this time, and I thank the President for this, we put a lot of money in primary health care. We should address this. Because there is no prevention, this is hereditary. There is a lot of treatment required, as a member has said here, sometimes 2-3 times a week. And what that does is only through prophylactic care, replacing all those missing clotting concentrates so that a patient can feel much better. When it comes to joint bleeding, Madam Speaker, this thing is very, very painful. And we don't have capacities yet to diagnose and screen on time. And that would mean human resource for health to be looked into so that they can be posted in those proposed 47 facility, one in each county. Lastly, which is very important, Madam Speaker, families do not know if it is not diagnosed on time and referred on time. That would mean retraining even our healthcare providers on how to diagnose and screen and refer them to time. It doesn't only affect the physical nature of human being. This thing has also psychological effects. That would also require, at least if we have one facility caring for these hemophiliac patients, then we should also recommend that we have psychological providers posted to these facilities so that the families can get appropriate counseling when they have these conditions to deal with. As a committee or as a house, I think it will be much of a due to want the ministry to do this. And in our committee, we are privileged to have the vice chair for budget, even if it means having a line item for this particular disease. There are only about 4,500 to 5,500 individuals. We could include funding for them so that when the donor support elapses, we can have our own funding and caring for our own people. Thank you, Madam Speaker. I think this is worth supporting, and I encourage all members, let's pass this quickly so that we can get it into action. Thank you, Madam Speaker.
Honorable Oundo, I think I've seen. Honorable Oundo is not there. You're number one on the list and you're not here yet. Yes, Honorable Member for Nyeri, I'll come to you next. Okay, I think Honorable Oundo, I'll let you settle down first. Okay, the Honorable Member for Nyeri, Honorable Mathenge.
Thank you, Madam Speaker. Madam Speaker, from the onset, I'm a member of the Health Committee, and we sat through this petition, and I stood in support of the report and the recommendations of the committee. Madam Speaker, this petition by the Hemophilia Society of Kenya goes to the core of our Constitution, in particular Article 27, equal protection and equal benefit of the law for hemophilia patients in this country. And when we superimpose that on Article 43, on the right to the highest attainable standard for health, and the report that the chair of the committee has laid before the House in terms of the absence of facilities, absence of medical supplies, absence of personnel, then we realize that as a country, we have a segment of our population that we have really disadvantaged. Honorable Speaker, preventable breeding is a health crisis for a family, for a hemophilia patient. It is an education crisis for a family with hemophilic students. It is an employment crisis for a family with adults who cannot go to work on account of bleeding that is preventable. It is a disability crisis because a person suffering from hemophilia, once there is onset, they are unable to do a lot of things for themselves. And this simply translates into catastrophic out-of-pocket expenditure for these households. Madam Speaker, the appeal by the petitioners was very simple. Treat hemophilia before it demands for treatment. What does that mean? It therefore means that we should be able to provide the supplies that are needed to prevent the onset of hemophilia once it has been diagnosed. Madam Speaker, I want to thank the Federation of Hemophilia Humanitarian Program and other development partners who have really supported our patients in this country this far. However, donor programs cannot supplement, they cannot be the primary source of providing care. A national program should be in place, and the donor programs should complement the national initiative. Honorable Speaker, with the coming in of the ECCIF fund, hemophilia squarely fits within the conditions that should directly benefit under ECCIF. For this to happen, we need hemophilia to be expressly named with clearly defined service packages, medicines, and tariffs under ECCIF. Secondly, the transition from the other funds into ECCIF for hemophilia patients must be simple and clear. Madam Speaker, what does it mean if we could grant, if this country can grant the plea of the Hemophilia Society of Kenya? One, we would reduce emergency admissions. Two, we would allow children suffering from hemophilia to continue with their education uninterrupted. We would reduce chronic pain and long-term disability. We will protect families from catastrophic health expenditure. Early diagnosis, clotting factor replacement therapy, prophylaxis, and a national registry are very low-lying fruits for this country. Madam Speaker, I urge this House to support the report of the committee and support its speedy implementation. Thank you, Madam Speaker.
Honorable Zamzam, member for Mombasa.
Asante sana Mheshimiwa Spika, na mimi niweze kuunga kamati ya afya mkono kwa kuweza kuleta mjadala hapa bungeni. Mheshimiwa Spika, Mheshimiwa Spika, hemophilia ni ugonjwa ambao unagandisha damu, ambapo kwamba utaona mtoto ama mtu akikatwa kidogo damu inamwagika kwa wingi. Mheshimiwa Spika, huu ugonjwa ni ugonjwa ambao ni wa kurithi kutoka kwa mzazi, na Mheshimiwa Spika, ugonjwa huu kutibiwa peke yake inachukua gharama kubwa sana. Unaona hata ile kutibu mtoto mdogo ni 50,000 mpaka 100,000, 150,000. Kwa mtu mzima ni 300,000. Mheshimiwa Spika, ugonjwa hauchagui maskini ama tajiri. Mheshimiwa Spika, kwa hiyo mimi ningependa kuweza kumunga mkono ndugu yangu ambaye ameleta hii bila hapa bunge, ya kusema kuwa huu ugonjwa unafaa utiliwe maanani katika taifa na bajeti ya Kenya. Mheshimiwa Spika, ili tuweze kupata katika mahospitali yetu, manake hawa wagonjwa kama hawa, hospitali ambayo inatibiwa hapa Kenya unapata ni hospitali 2 peke yake, wakati ambapo wagonjwa wako sehemu zote za Kenya. Mheshimiwa Spika, na mtu anaweza akapata jeraha, ama kwa mtoto mdogo anaweza kutairiwa ukaona anamwaga damu mingi sana mpaka kupelekea kifo. Mheshimiwa Spika, kwa hiyo kuna mahitaji makubwa sana kuweza kupata huduma ya afya katika sehemu zote Kenya. Kisha pia katika SHA waiweke kuwa hiyo katika magonjwa ambao ni yale magonjwa ya dharura, na ni magonjwa ambayo ni yale magonjwa mazito kama vile wanavyoweka high blood pressure, ugonjwa wa sukari, pia hii iwekwa katika ile msururu. Mheshimiwa Spika, ili hawa watu kupika pale hospitali waweze kuangaliwa kwa uangalifu. Mheshimiwa Spika, kwa hiyo mimi niweze tu kusema mmefanya jambo la maana sana. Huu ugonjwa vile ninavyosema hauchagui, na mtu anaweza kuwa pengine amedungwa hata sindani ama amekatwa na kijembe, unapata damu inamwaika nyingi na mtu hajui kama kwa mfano ana huo ugonjwa. Mheshimiwa Spika, kwa hiyo huu ugonjwa ni ugonjwa ambao watu wengi hawana ufahamu nao. Mtu anaweza kuona tu mtoto ana overbleed akafikiria pengine ni kitu cha kawaida, kumbe ni ule ugonjwa wa hemophilia, Mheshimiwa Spika. Kwa hiyo mimi napenda kuunga mkono na niseme mahospitali yetu ndani ya Kenya tupate madaktari kila sehemu na waweze kupata mgao wa kuweza kukabili ugonjwa huu, Mheshimiwa Spika, kwa sababu ni ugonjwa ambao unachukua pesa nyingi sana kuweza kuutibu, Mheshimiwa Spika. Na mimi niseme hata nikipata pale Makadara Hospital tukapata daktari na SHA ikaweza kusimamia vizuri, Mheshimiwa Spika, kama mama kaunti wa Mombasa, naweza nikashukuru sana. Manake wagonjwa wengi hawajui kuna maradhi ambayo yanatokea na hawajui kuwa maradhi haya ni kitu fulani. Kwa hiyo kama kuokoa maisha ya mtu, ni madaktari lazima wawe karibu na hospitali zetu ziweze kutoa haya matibabu ama hizi services za hawa wagonjwa, Mheshimiwa Spika. Kwa hayo nashukuru sana.
Before we go to the next speaker, I want to recognize the presence of Kambiamoto School from Rongai constituency, Nakuru County, and also Kisanana Primary School from Mogotio constituency, Baringo County, who are seated in the speakers gallery. We welcome you to the precincts of Parliament. Asante. Member for Wajir North.
Madam Speaker, I'm not a medical practitioner, neither a member of the Health Committee. But from my little scan and eavesdrops regarding hemophilia blood disorder, I want to say that by contributing that this has been a problem in Kenya, and Kenya cannot afford the right treatment except preventive care. The treatment of hemophilia bleeding disorder requires serious technologies, advanced technologies of replacement of bone marrow and some other things, which Kenya is really ill-equipped. I've also come to learn that the early treatment of hemophilia bleeding disease counts for the longevity of any patient suffering from the same problem. The causes of these diseases are very severe. It causes disability, physical and psychological issues in the society. In as much as it is genetical, I've also realized that the one mistake we do, we only address hemophilia when it is at an advanced stage, not at the early onset when it is manageable. By then, this disability is knocking, and all other attendant issues that could come with the advanced stage of hemophilia bleeding is also with you. That is the unfortunate part of hemophilia bleeding disorder, Mr. Speaker. So the earlier we treat patients, the better for their survival, Mr. Speaker. Madam Speaker, sorry. So it's all about managing severe bleeding and avoiding the permanent damage associated with it. Madam Speaker, in preventing hemophilia, you need to control clotting of blood. You must encourage clotting of blood. Lack of clotting is the cause of bleeding. And avoiding the issuance of blood-thinning drugs to patients of hemophilia is also a concern. And making sure that there is enough civic education so that they are not engaged in extraneous, serious physical exercises. Low-level intensive exercises is required. Circumcision, as is common in the rural folks, is also a concern, because you may happen to circumcise a patient of hemophilia, then that is the beginning of a problem, like ignorance on the part of those doing circumcision. Even there are those who are doing cupping traditionally. Cupping. And many, and even properly some dental measures have to be sensitive to hemophilia bleeding disorder patients. So we need actually a specialized way of handling this unique disease.
Blood transfusion is one of them. We must have serious donors and blood banks across this country. I've realized the high costs associated with managing this disease. In Kenya, it's not treatable, it is only the management we are talking about. The high costs, we also depend on donor. Hardly do we budget and factor in this. I've realized it's only 14% of those who are affected, and that means there is low rate of diagnosis. Meaning many are out there unknown. So our statistics are not yet updated on hemophilia bleeding disorders, Mr. Speaker. Then there are issues of stigma, just like HIV/AIDS. Once you are seen to be bleeding, people associate you with all kinds of curses and unwarranted things to make you out of place in the society. Of concern to me is the rural community where I come from, northern Kenya, Wajir County. How do you treat a hemophilia bleeding disorder patients when there are only 14 facilities or so? That is to tell you the former professional hospitals and few in Nairobi are the only ones privileged to treat hemophilia diseases, Madam Speaker. The non-inclusion of Madam Speaker, my concern is the rural communities, which is largely the representation of Kenya, that cannot treat hemophilia bleeding diseases. I come from Wajir, 56,000 square kilometers on the northern part of Kenya, Mandera, Marsabit County, Lodwar, Baringo, even let us Pokot. Many cannot really get the treatment that those around Nairobi can get. That means the rural communities require a facility that is at least closer to them, Madam Speaker. And lastly, I know SHA has been implemented quite recently. It is still having teething issues, but doing very well. I'm sure the Cabinet Secretary is listening to this debate. We also plead that this should be included in the public health insurance program in Kenya, so that we can at least give them the rights they so deserve. With those few lay contributions, I support.
Thank you. The Honourable Member for Funyula.
Thank you, Honourable Speaker. Let me also join my colleagues and the rest of Kenyans supporting this petition and the report on the petition that was submitted by Mr. James Kago, the Treasurer of the Hemophilia Association of Kenya. Honorable Speaker, we might not have to say much, but Honorable Speaker, looking at the report as presented by the committee and looking at several presentations, and allow me, Honorable Speaker, to quote the one from the Ministry of Health, which says hemophilia is a hereditary bleeding disorder arising from a deficiency of clotting factors resulting in prolonged bleeding episodes, increased risk of a disability, and significantly reduced quality of life for affected individuals. However, Honorable Speaker, there are 3 or so telling issues here that raises a lot of concern. One is the lack of specialized medical facilities that can diagnose and treat the condition. That's number one. Number 2 is the chilling fact that the treatment of this disorder is not covered in the Social Health Authority program. Those 2 issues are really chilling issues. Honorable Speaker, we pride ourselves, we have talked endlessly how we intend to achieve universal health care. These kind of medical conditions, being rare as they are and being complicated as they are, and I have it from Dr. Nyikal, that the condition is not treatable, it is only managed. So it needs to be managed in an orderly manner. Honorable Speaker, it's also on record that it is costly to manage this condition because you never know when it will hit and you do not know how long somebody will bleed because the clothing that normally happens to stop further bleeding is the cause of this matter. Honorable Speaker, I also now want to address the committee observations and recommendations, which are fairly elaborate, and since being not a medical doctor, I don't want to go into matters, that is not my forte, but only to note a few issues that have been highlighted by the committee. That number C, for example, paragraph 56C, the committee recommends the Cabinet Secretary, Minister of Health, and the Social Health Authority, and the Benefits Package and Tariffs Advisory Panel to develop comprehensive hemophilia benefits package under the Primary Health Care Fund, the Social Health Insurance Fund, and the Emergency Chronic and Critical Illness Fund. Honorable Speaker, this is where we can start this debate. However, Honorable Speaker, in all subsequent or the successive budgets, national budgets, appropriation bill, we has always come out very clear that both the primary health care component fund and the emergency chronic and critical illness fund is grossly underfunded. Grossly underfunded. It therefore means that even this recommendation and the prayer can only be for soothing the soul of the patients, but we need to find ways and means of making it a reality. Honorable Speaker, the second recommendation that is also important is the issue that the Ministry of Health and the county governments regularly trains community health promoters and community health officers and assistants on early identification and referral of bleeding disorders. Honorable Speaker, in many counties, CHPs are underfunded, are underprovided, they're under-enumerated to an extent that even additional training will not assist them much. So therefore, Honorable Speaker, all that we are saying at the end of the day is that we must find ways and means of making available funds to treat this unique condition that is hereditary, and I have been told by Dr. Nyikal that it seems to affect mostly male species, and that's why we always say the boy child and the male child is an endangered species in this country. We need to continuously pray. Finally, Honorable Speaker, I would like just ask one. Yes, Honorable Speaker, the petitioners and again the committee has said that we should consider this as a disability. That somebody suffering from this condition should be a person considered as a disabling condition so they can benefit from the Persons with Disabilities Act 2025. I totally agree, and I propose that further, Honorable Speaker, there was a debate some days back on our WhatsApp group that said some social disorders, some disorders should also be considered as a matter of disability. But when that petition finally comes to the floor of the House, I hope we'll be allowed to debate it robustly, probably later in the night when children are asleep. Thank you, Honorable Speaker.
Are you saying, Honorable Undo, that whatever motion will be unconstitutional and unsuitable for the House?
Which one?
The one you're going to bring.
Yeah, it will be constitutionally, because the Parliament hears all the problems of Kenyans. So that's why I say in that debate, it should be age sensitive, it must be X-rated, so that members can discuss openly without fear and embarrassment. You know, it is watched by children, mothers-in-laws, fathers-in-laws, and you see now some things now when you are seated there, you are constrained from what to say. That's why sometimes some things are discussed in specific forums. Thank you, Honorable Speaker.
Very well, Honorable Undo. I do not seem to see more interest on this, so I'll call the mover to reply. Honorable Nyikal.
Thank you, Madam Speaker. Let me start by thanking all the members that have contributed. I really appreciate the support that the petition has got and the recommendation that you have put in place. And I'll just ask that we get the Committee on Implementation to actually take up this and move on with it and work with the Ministry of Ministry of Health, Ministry of Education, and all the relevant bodies so that we don't discuss in vain. And I think as a committee, we'll actually follow up. There are some like financial provisions in the budget, those will follow up. It's something we need to take up. And therefore, Madam Speaker, once again, let me thank my committee, all those contributions you have had, and I beg to reply.
Very well, Chair Health Committee. Honorable members, I shall defer the putting of the question on this motion. We, as had been guided by the Speaker earlier, with the reorganization of the order paper, we shall then go back to order number 12. Honorable members, in the Speaker's gallery, we have the members of the Hemophilia Association. We would like to thank you for sitting through the debate. It has got overwhelming support, and we thank you for coming and observing the proceedings in the House. You are free to leave at your pleasure. Next order.
Order number 12. The County Assembly Services Amendment Bill, Senate Bill number 34 of 2023. Second reading.
I do not see the chairperson for the Departmental Committee on Labor, so this shall be deferred.
Order number 13, motion, report of the Kenya delegation to the 151st Assembly of the Interparliamentary Union, IPU, and related meetings.
This is by the leader of delegation. I'm told it's Honorable Millie Odhiambo, who is not in the House, so it shall be deferred.
Order number 15, motion, second report on the status of reports on petitions and resolutions.
This is by the chairperson, Committee on Implementation, that is Honorable Member for Budalangi, who is also not in the House. Has he delegated? No. Then we shall defer it.
Order number 16, motion, consideration of a petition regarding the proposal to amend the Consumer Protection Act.
This is by the Public Petitions Committee. I do not seem to see the chair in the House. We shall defer it as the others.
Order number 17, motion, report on the audited financial statements of selected state corporations in the roads and transport sector.
This is by the chairperson, Public Investments Committee on Commercial Affairs and Energy. Is the chair in the House? If not, we defer it.
Order number 18.
Hold on, before the next order, Majority Leader.
Thank you very much, Honorable Speaker. In the absence of the chair, I would like to reply.
Honorable Owen, you want to reply on order number 21? We are not there yet. Hold on. My
apologies.
Yes, we've just dealt with order number 17. Okay. Now we go to order number 18.
All right.
Order number 18, the Books and Newspapers Amendment Bill, National Assembly Bill number 47 of 2025, second reading.
I don't know where the chairs are. This is for the chairperson, Parliamentary Broadcasting and Library Committee. And I say that because as the vice chair of Liaison Committee, this committee has complained a lot that this bill has not come for second reading and they are not in the House, so it shall be deferred. Yes, Honorable, is that on Choke?
Yes.
Yes, what is out of order? Do you want to move?
I've just spoken with the chairs around the corner. Should be here in a minute.
It's already been passed. We've already deferred it. Next.
Order number 19, motion for the report on audited financial statements for the National Assembly Constituencies Development Fund.
This by the Chairperson, Decentralized Funds Account Committee. Again, not in the House, shall be deferred. Next order.
Order number 20, the County Library Services Bill, Senate Bill number 40 of 2024, second reading.
The Chairperson, Departmental Committee on Sports and Culture, not in the House, shall be deferred. Next order.
Order number 21, the Business Laws Amendment Bill, Senate Bill number 51 of 2024.
This is under the leader of the majority, still on second reading. I do not see any interest for debate, so I shall call Honorable Owen Bayer to reply.
Thank you very much, Honorable Speaker. Honorable Speaker, in reply from the majority side, Honorable Speaker, we'd like to say that we need to create a good and conducive environment for doing business in this country. And good laws are very important in ensuring that we have laws that allow us to do good business. And I want to thank all the members that contributed to this debate. And we take cognizance of the issues that they raised so that we may improve this bill, so that as we come to the third reading committee of the whole, Honorable Speaker, we will have a law that will ground this country very well into business matters, so that people see Kenya as a good place for investment and a good place for business. I reply.
Very well. Honorable members, for obvious reasons, I shall defer the putting of the question on this. Next order.
Order number 22, the Competition Amendment Bill, National Assembly Bill number 4 of 2026.
This for you, Majority Leader. We are on second reading and there is no more interest for debate. Could you reply?
Yes, Honorable Speaker, I beg to reply on the Competitions Amendment Bill, National Assembly Bill number 4 of 2026, and say this, Honorable Speaker, the competition law has been in existence in this country, and it is time that we amend it. And I want to, on this point, thank all the members that contributed to make sure that the competitions bill is amended to make it more effective, so that it can be in tandem with the business environment that we have. The business laws, Honorable Speaker, and the Competitions Amendment Bill, both, Honorable Speaker, are in a way trying to midwife this country into the next level of development, especially in business.